Hi there, my name is Ken Kalis. I'm going to talk a little bit about schizophrenia. There's the paranoid type, there's the catatonic type, there's the undifferentiated type, and there's also residual type. Is usually when people get treatment and they get rid of the psychosis, the delusions, the paranoia, and her voices usually go away. The paranoid type is when you're hearing voices, delusional, paranoid. There's the catatonic type. There's also the kind that also have delusions of grandeur, which think they're Jesus Christ, or they think they're somebody they're not, somebody really famous or something, or think they're the opposite. They think they're some bad thing or whatever. It's something that they're really not. They delusions of grandeur is like they think they're like, it's something that they may not be. Paranoid type is usually the type, they usually have delusions of persecution, think people are out to hurt them, kill them, hurt them, or you're out to do harm to them. And then there's also people usually with schizophrenia, usually diagnosed men usually between the age of 15 and 25, and women usually between the age of 35 and between 25 and 35. Now, some people get more functional with this than others. Some people remain institutionalized for a while. Some people get institutionalized all their life. Some people get functional and they live a normal life to some extent, but they might be needing help of some sort. And like I said, they might need help like therapy, or need help with assistance and with assistance with Social Security, insurance companies to pay for their medication, and places to go, and people to help them, with therapists and doctors to help them with their condition. Most people achieve some sort of recovery from this. And I wouldn't say everybody, but some people. And the residual type is when they all the psychosis like delusions, paranoia, and all these different things are gone. And so that can happen after a number of years of treatment. Usually people get better with time, take their medication, and see doctors and therapists, and some really recover pretty well. It's a treatable disease, and not everybody has to be institutionalized or be in hospitals all their life, or in hospitals all their life. Some people just take their medication, use the therapist, doctor, and live independently, and live in apartments with help. And some people live in apartments independently with just help of the government. And some people live in institutions like halfway houses, nursing homes, or group homes, or live with their parents or something like that. But some people, usually they take their medication and they see your doctors and therapists, they get some sort of relief from this illness after a number of years. And my name is Ken Kalis, and I know because I've seen them and been around them and know about them, and I know from experience with knowing some people that have it, and knowing people that have been treated for it, and knowing how it affects people. So, and I also know a lot about it. So I'm not a doctor or a therapist, but my experience with knowing about it and reading about it, and also knowing different things about the illness, I know I know pretty much what I'm talking about. Have a nice day. I'm not a doctor or therapist, but I know what I'm talking about. Have a good day, man.